I'm Professor Lesley Fallowfield, Professor of Psycho-Oncology at Brighton and Sussex Medical School. I'm Director of SHAWSEE. That stands for Sussex Health Outcomes, Research and Education in Cancer, and that's essentially what we do. The group is divided into probably around 3 different parts. The first part is looking at quality of life or patient-reported outcomes in big clinical treatment trials of cancer. These can be national as well as international. And one of the things that the group does, apart from coordinating the psychosocial sub-studies, is develop quality of life measures. That's a bit more complicated than just sticking a few items down on a questionnaire. It requires quite a bit of research. It's a discipline in itself, psychometrics. And we've established our role, I think, as experts in the development of novel, new quality of life measures for use in cancer. One of the things about cancer treatments, of course, is that you might well find that you have a new treatment or a new procedure that does help patients for hopefully many years or cure them, but sometimes you're looking at really quite modest improvements of maybe only a few weeks or a few months. And it's very important, therefore, to determine whether or not that actually is worthwhile to a patient suffering side effects of treatment, having to come along sometimes to the cancer centre for those treatments. So that's one really important aspect of our work. The second area is what we would describe as ameliorative interventions. Now, basically, what that means is that once you've developed a new drug and shown in a clinical trial that it really is worthwhile for a patient, all drugs, irrespective of whether or not they're very good at helping the cancer, have side effects associated with them. So our team also work on ways to, if you like, help patients cope with the different side effects that they might be experiencing. That may well be things like hot flushes if you've got prostate cancer and you're being treated with hormone therapies, or horrible arthritic pains for women who are taking drugs called aromatase inhibitors for breast cancer. We've also worked on ways to help patients who've got arm mobility problems following breast cancer surgery. This could be yoga, Pilates and things like that. So that's the second important area of our work. Now the third increasingly important one is helping healthcare professionals talk to patients in ways that helps them understand. We've seen a big change over the last few years in terms of something known as patient centricity, patient centeredness, and an expectation that patients share decision making about treatments with their doctors. Well, of course, you can only decide between the different treatments that might be on offer for you if you're educated enough to understand what on earth everybody's talking about. And cancer is a very strange language, as many patients and their families will know. So one of the exciting things that's happened over the last couple of decades is that we've seen many improvements in the basic science and understanding of cancer. But this means that although we therefore recognise why different sorts of cancers might be better treated in certain sorts of ways, more personalised or targeted ways, we've got to help a patient understand what that means. And you almost need an undergraduate degree, quite frankly, to understand the rationale, the logic for the sorts of treatments that may or may not be appropriate for the individual with cancer. So one of the really increasingly important areas of our research is to design, develop and then evaluate communication skills training programs for healthcare professionals who are trying to help patients make more informed decisions about their treatment. These courses, once we've actually demonstrated that they actually do improve skills, are then rolled out by trained facilitators, not just in this country. We have a global reach with many of our programs. So that's a lot of work we do, the clinical trials, development of patient-reported outcomes, helping to design programs to assist patients coping with the worst side effects of treatments, and then the communication skills training programs for all healthcare professionals. We also make user-friendly or patient-friendly films for patients and their families so that they have got a fighting chance of understanding a little more what on earth is actually involved with the different treatments. And I'm very proud that we're part of Brighton and Sussex Medical School that permits us to do such a wide range of projects. The most significant parts of our research are that we have established validated, standardised measures for use in clinical trials in lots of different languages worldwide. Most of the clinical trials of cancer treatments now are global. They require thousands of patients, and therefore once you have developed a suitable way of measuring what matters to patients in English, you need to also translate it and ensure that it's culturally appropriate in other countries. So I think one of the things that Shaughtsea have developed a really quite well-established reputation for is the development of quality of life measures or patient-reported outcome measures that are used all over the world. Anyone who might be interested in collaborating with some of the work that Shaughtsea does, or indeed seeing some of the resources that are available within the group, only need to go on our website. If you just type in Shaughtsea and BSMS, I'm sure that will come up quite easily for you.